I think everyone who's listening to this today is probably highly motivated to provide patient-centered care. That's the reason we went into training. It's the reason that our families hope that we turn out to be good doctors and nurses. Somewhere along the way, though, we start to realize there's only so many hours in the day, there's a lot of patients to be seen, and we try to cut corners, or we learn to cut corners, or we see others cutting corners. One of the things that happens when care is not patient-centered, and I don't think we often think about this very much, is that when care is more patient-centered, our patients tend to follow our instructions. They tend to follow the plan. And if my patients don't follow my plans, the outcomes are not going to be very good for them. If they don't take their medicines, the outcomes won't be very good. And so care that's more patient-centered is much more satisfying to the patients. They have a higher level of trust with their caregivers and much more likely to follow the plan. There was a very interesting article by Dr. Dana Safran, who is from Tufts. And one of the things that Dr. Safran and her researchers found is that in an average primary care physician's patient panel of 2,000 patients, 20% of those patients turn over every 3 years. And the reason they turn over in her study was that they didn't like their doctor very much, or they thought that another doctor might be more satisfying to them. So if you think about the cost of that in human terms, if I have 2,000 patients in my panel, that means every 3 years I've got to find 400 new ones because of the ones that left because they thought somebody might be nicer or they might like them better. So finding 400 new patients is a lot of work for a practice. There's a lot of waste in it. It takes a lot of time and effort to register those patients, to develop charts, to get to know them, and then when they leave, it's, again, more work to replace them. So patient-centered care does take more time. A lot of studies have shown it adds a few minutes to each of the encounters, and that's a problem for physicians. So they need to see a certain number of patients a day. But when you look at some of the other costs, patients not following their treatment plan, the cost of getting new patients into the practice, patient-centered care can be very beneficial.